Hi, I'm Lachey. Please excuse me if I do stutter a little bit. I'm definitely trying to get my speech back after my stroke, but work with me. This is my week 2 assignment. I'm doing a presentation on Ashford Medical Creative and Innovation Practice. UAGC, MHA 601, Principle of Healthcare and Administration. Ashford Medical, welcome to a presentation discuss healthcare innovation technology, healthcare innovation examples. In this PowerPoint, I will outline creative ways that Ashford Medical can use different tools to grow with the organization. For the 7 slides shown, I will define creative innovation and innovation as a newly hired individual. I will give my input into what I believe would help me and others improve in the Ashford Medical Organization. With new technology such as electronic health records, it was supposed to help the organization, but it does have its barriers in the organization. Healthcare innovation, electronic health records impact quality care and barriers. As a new hire individual to Ashford Medical, I have seen that it's a great place to work and it has new technology to help the employees of Ashford Medical, but it has its downside. I have noticed that the medical organization has put in place to help the staff and make it much easier for staff to take care of patients. One way the organization has helped the healthcare system is by implementing electronic health records, which are also EHRs. EHRs are the record keeping platform that gives those who work within the Ashford Medical Organization access to patient information quickly. Another great thing about access to EHRs is that it improves the coordination of healthcare providers. Impact, improve care EHRs, emphasis of EHRs. When it comes to how EHRs improve the quality of care of so many of our patients, it provides Ashford Medical employees a great view of the patient's history to lead to better outcome for the patients. The emphasis in the medical organization has increased, giving the administrator of health care a better way to access patient files besides paperwork. It also allows healthcare employees to share patients' information more easily to save a life. Barriers of EHRs cause resistance of change into strategies. The cost of new technology in a healthcare organization such as this is high. It can range from deployment method, which means if it would be on site or web-based, functional flexibility, level of use in a vendor, support play a great factor in the cost. The system can be hardwired, which means it has no backup for amounts of data. When it comes to software, it allows it to be backed up to a cloud where information can be accessed anytime. When it comes to change, it can be difficult. In the healthcare, it has been years or months of how things were run. Employees want to stick by the norm. Having a new system such as the EHRs can challenge those who are used to the norm. 2 ways to implement change is to get the healthcare organization involved in the process. Also making sure everyone knows the benefits of the benefits that EHRS bring. Healthcare Innovation Leadership. Wednesday breakfast meeting let all employees speak a daily quote, asking what it means to them, how that it can be used throughout the day. As a leader of Ashford Medical, I will implement Wednesday breakfast meetings. Started with those like myself who need a Wednesday pick-me-up. My team and I came up with a way to get all employees to pick a daily quote from a jar. It allowed everyone to pick one quote that would speak to them and throughout the day, which allowed them to have more positivity with patients and themselves. It gave them more energy or a boost to keep going throughout the day. As a person who would be newly hired, I would love to keep this going. It also shows our employees that we care about mental health, but want to make sure as the organization that we can keep them, employees, going for the rest of the week. Innovation means a new idea, device, or method. The business model that we implemented brings new ideas to organizations and a new method. Conclusion. Healthcare innovations impact barriers of EHRS, healthcare innovation and leadership. I have explained the process and how as a leader for the Ashford Medical Practice, how it would bring EHRS to the hospitals, what it would cause, and the barriers it would cause by changing the norms of the hospital. As a leader, I also explain how I focus not solely on the system, but the people it takes to run the system. I would make sure every week or every 2 weeks that employees are acknowledged for their hard work and focus on mental and demanding aspects of the job. Thank you.